Okay, before we get too far into this, I'm just going to come right out and say it. There's going to be a lot of people that are going to be a little critical and probably a little unhappy with what I'm about to share with you. And that's okay because I didn't do this for them. I'm doing this for people that really want to know how their body works, how to take care of it better, how to take care of their families and their friends and know what's right from wrong, know the truth about their body. So here it goes. I'm going to share with you a shocking study that was published in October of 1998 in the Journal of Bone and Joint Surgery. Long story short, they wanted to test and analyze what is the basic competency level for medical doctors doing musculoskeletal diagnosis and exam work. Now, important thing to note here is a passing grade was only 73.1%. So they weren't looking for who's the rock stars. They weren't looking for A plus, B plus students. They were just looking for who can pass a basic test. Now, in the 1998 study, only 17.6% of the participants could pass the test. They recreated the study in 2005, and only 20.7% of those people could actually pass that test. Holy cow, what does that tell you? That tells you that a lot of people out there are misinformed because most people go to a medical doctor, go to a primary care physician when they have musculoskeletal complaints. Neck pain, back pain, headaches, sciatica, disc pain, joint pain. People are going to medical doctors in droves assuming that they know what they're doing and they're highly trained and skilled at doing exam and diagnosis and treatment work. These two studies would suggest maybe that's wrong, maybe that's not right. Now they gave the same study to chiropractors, who not so surprisingly passed with flying colors. The reason being is medical doctors and chiropractors are both very intelligent people. They go to school for a long time, equally long time. In fact, chiropractors actually spend more time in school getting their education and degree than medical doctors. Most people have never heard that before, but that's a fact. Now, the difference here is chiropractors spend a large amount of time being educated on musculoskeletal things, stuff. So they're hyper educated when it comes to the musculoskeletal system, especially when compared to your average medical doctor off the street. So again, what does that tell you? If you have a musculoskeletal complaint or you even suspect you have one, knowing this information, who's the best first course of action? Do you really want to go to the D plus student or the A plus, B plus student? Big difference in the outcome. And I think this is why my office is filled with people who've already been to other people and aren't getting even a good exam, much less a good diagnosis, and they certainly aren't getting better, which is why they end up coming to me as the last resort. They should have been coming to me as first resort. So I'm sharing this with the public not to cast a bad light on medical doctors. That's not what this is about. This is about raising public awareness about these two studies that would help us make better decisions if we all knew about the findings and we all knew about the difference in education between a medical doctor and a chiropractor. Now, there's another interesting thing to note about this study is they took all those people from those studies and they clumped them, all the medical doctors, and clumped them together and said, were you confident to take this or not confident? Okay, I'm not really concerned about the people that said, I'm not really confident, my training, my schooling doesn't make me feel comfortable doing musculoskeletal work. I'm concerned about the people that said, yeah, I do feel comfortable and confident doing a musculoskeletal exam. You know what their average test score was? The confident medical doctor to do a musculoskeletal exam and diagnosis? 66% was the average score. Again, that's a fail, right? So again, D plus student, A plus student. I'm doing this, I want this to be very clear. I want to raise public awareness because I think if more people knew about this difference, knew about how hyper-educated chiropractors were about a lot of things, but just the musculoskeletal stuff, compared to a medical doctor, most people would make a radical shift, paradigm shift, and go to the chiropractor first. Now, I use an analogy in my office, which is kind of stupid, silly, but it works here. If you have an automobile problem, you don't take it to the bicycle repair guy, right? You got to know that if you have a musculoskeletal problem or an automobile problem, you want to go to the best expert for the job. So you go to the mechanic, the most highly trained mechanic that you can find. You're going to get the best outcome there, right? Now, sure, you can go to the bicycle repair guy or girl, and they've probably got some tools laying around. They may have some advice, they may have some ideas, but again, you're not in the right place to get the right job done. So again, I'm suggesting that if you have any musculoskeletal problems going forward in the future or now, and you think, even if you suspect it might be musculoskeletal related, we need to change our mindset and start looking to the chiropractor first for advice, and then maybe using modern medicine as an alternative later on. Does that make sense? So Again, I want you guys to know this stuff. I want you and your families and friends to start benefiting from this. Because I think we could all be living a whole lot better than we are right now. And I think we deserve better health care than what we're getting. And it really hinges on advice like this being first understood and then shared properly. So I'm encouraging you guys to share this with your circle of influence on your social network. Please tell your moms and dads and your nieces and your nephews. Help them start to make that mental shift of what doctors do what, and who should I be going to first versus last for great advice. So my last recommendation in closing is find yourself a good chiropractor that lives near you. They can help you more than you can imagine.